Hi, I'm Dr. Ron Miller of Pursuit Physiotherapy, and today we're talking about what really is a low back muscle spasm. And if you've been diagnosed with a low back muscle strain or sprain, does it really mean anything? So, for example, if you've been diagnosed with a low back strain or sprain, unless you have a drastic mechanism of injury, like you're doing a deadlift and you pulled a muscle or you're lifting something, it's really uncommon to really have or to strain your low back paraspinal muscles. That's just a symptom. If you're having some muscle soreness or you're having some low back muscle spasms, these are effects. It's very rare to truly get a low back sprain or strain, and many physicians will just put on your script saying low back strain, sprain, just treat. That really doesn't mean anything. That means they don't know the real cause of your low back pain. Now, what does it mean when you have low back muscle spasms? Okay, so whether it's a true strain or a sprain or a muscle spasm, this is an effect, okay? You'll have a cause and you'll have a effect. Now, the effect of the low back injury is having muscle spasms. That means that, for example, it could be like the way your body's protecting itself. You have a back injury, whether it's a facet joint, a disc, and your body is kind of protecting itself by inducing a muscle spasm. It doesn't want you to bend forward, or you're sitting all day is causing too much strain to your low back, thus it's trying to protect itself. It doesn't want to move in that direction, so then you get a muscle spasm, okay? The muscle spasm is not the problem, okay? There's some sort of underlying factor, injury, something that's predisposing you to have the muscle spasms or the muscle tightness, or I like to use the word muscle hypertonicity. So if you've been diagnosed with just a sprain strain, that doesn't mean anything, and there's some sort of underlying principle. If you're experiencing muscle spasms in the low back area, there's something overloading the lumbar spine, or there's some injury that's underlying it that's causing the muscle spasm. Now, the answer to your problem is, can you identify what that risk factor or that underlying problem is, or the injury that's causing it? Many times, if it's a herniated disc, and you have muscle spasms from there, you may have leg pain that's shooting down the back or the front of your leg. And you'll say that sitting aggravates it a lot, and maybe standing and walking makes it better. If it's just a acute injury, like you injured yourself in the gym, many times if you try to get back to that same like weightlift or that same maneuver, you'll probably get back pain again. Your body's not ready to return to that activity. Many times if you're sitting at work and you're getting muscle spasms at work, it's the sitting, the position that you're in, that's overloading the low back, thus getting the muscle spasm and your body trying to protect itself. So I hope you found this informative. If you like this information, please share it on any social media or Facebook. If you're experiencing muscle spasms in the low back region, or if you've been diagnosed with a sprain strain in the low back and you're suffering with low back pain, please give us a call. We'll get you right in for a thorough evaluation, and we'll solve that underlying problem of what is really causing you to have your low back pain, muscle spasms, or your sprain strain. So thank you very much for your time. If you have any further questions, visit pursuittherapy.com or give us a phone call at 407-494-8835. And thank you for your time.